Out of great care and concern for students, staff, and community safety, the Sioux Falls School District is making some adjustments. In short, we're reducing access to our schools by anyone who is not an employee or a student. This is difficult as we believe our buildings are community buildings, but right now we believe reduced access is best for our community. We feel very fortunate to have the expertise of Sanford and the Avera Health organizations, along with the Health Department of the City of Sioux Falls, to help provide us guidance and give us wisdom as we make decisions in the best interests of our students, our staff, and our community. To ensure we are keeping our schools safe and healthy environments for all students and staff, we've made the decision to suspend all non-essential activities starting today at 4 p.m. and moving until further notice. At this time, school remains in session for students and staff. While the Sioux Falls School District already has many protocols in place due to the cold and flu season, cleaning and disinfecting efforts have been ramped up to ensure that healthy people remain healthy. We're very mindful that routine is necessary and often comforting during uncertain times. Additionally, the district has an emergency operation plan that is aligned with the best practices specified by FEMA that we can quickly put into action if a case of COVID-19 were to be found in one of our facilities. A team of administrators here at the central office continues to meet with great frequency to share information from our local and state health officials and help us to plan resources. While the decision to suspend all non-essential activities until further notice has not been an easy decision, we can assure you we've worked closely with local and state health officials and feel the decision is a necessary decision to have made. It's our belief that we have a social responsibility to each other, to our community, and to society in situations such as these, and to be mindful that we are one community. With that, I would open it up for any questions that you have for Molly or for me.
Do we have any indications of any students testing positive at all?
No, I don't know of any students or staff that are testing positive.
We've had students asking sports practices.
Practices will continue. So if you're going to go to algebra class and English class, we think it's okay to go to track practice, but we'll keep that to our students and to our staff. And we'll keep that a confined area there.
Middle school dance was called off. We're trying to figure out what's on, what's off.
Yeah, well, I think really anything that would involve the community interaction would be off. So a dance tonight, our community engagement session, which is incredibly important to us, is called off for tonight. I know we have dances and musicals and concerts tonight and tomorrow night and really for quite some time. And then they're all suspended right now, postponed, slashed, canceled, depending upon the duration of this issue.
Is the cancellation of this community engagement meeting, is that going to affect the timeline for deciding on school boundaries?
Boy, I wish I knew, Perry. I would love to say no, but I think saying no is naive to the pandemic that we're dealing with right now. This isn't just a spike in absences that we're dealing with. It's, as of yesterday, officially a pandemic. And so I anticipate that the issue will become worse in our community before it becomes better. I use all of that as context to say the bad news is we've canceled the community engagement session for tonight. The good news is we have time. We were trying to put all of those plans in place a year in advance. That will still be our goal. We haven't abandoned that goal. But if this issue persists, time's on our side. That's the good news. The bad news is people have things they want to tell us, and we want to listen. We're not able to do that tonight.
Because there's another meeting, I think, Monday.
Yeah, Monday. That Monday meeting will for sure be moved as well. We'll still today we'll still plan on having each of those meetings as previously planned. I just don't know if we'll be able to hit that April timeline to hand this off to the Board of Education. Time and circumstances will tell us that.
At what point would you ever consider canceling school?
Yeah, I wish I knew that tipping point. And I think that's upon us. I really do. I don't think it's imminent. I don't think it's tomorrow. But I would tell you Tuesday, I didn't think we would be canceling our after-school activities either. So I think the health world is changing quickly, and we'll be as responsive to those changes as we can be. So I don't have a number. I don't have an absolute trigger that says that will call it off. But my mind is far more open to closing school today than it was just even a few days ago.
State tournaments, what's the word with that?
Well, I know the state tournaments are in town next week. We don't get to decide whether the state tournaments are held or not. But we do have 5 teams involved in those state tournaments. And I would tell you right now, I don't know that I would necessarily be okay with our kids going and participating in that in any capacity, even in a restricted fan environment. I'm not positive today that I would be okay with that. I love athletics. I love basketball. I'm on the Activities Association board. But I think right now we've got bigger concerns than basketball. Now, if I was a senior boy or girl and this was my chance, I'd be so mad at the superintendent right now. But as the superintendent, I have to make those decisions for our community. I'm not ready to make that decision today, but that weighs heavily on my mind. But so does, we have the show choirs going to Aberdeen, scheduled to go to Aberdeen Saturday, and to Sloan, Iowa, I think was the other one. Those kids also put as much time and as much energy into their activities. And who do we say yes to and who do we say no to? And I think at this point in time, it's really important for the leaders in our community and in our state to determine that health and safety is critical. Basketball isn't.
Are teachers already in the process of preparing for the possibility of online learning?
Yeah, yes, I would say that preparation has taken place long in advance of the pandemic. Now, we still have some work to do to make sure that everybody is as prepared as we would like, but we're prepared for that eventuality, and we'll be more prepared every day that we have where we have school and have an opportunity for some more professional development of our staff.
Now,
Our curriculum services department has been working very hard on that this week.
You mentioned the district was seeing maybe an increase in absence.
I don't think I said that.
Will you clarify?
Yeah, I don't know that.
As far as attendance?
The reason I say, Shelley, I don't think I said that is I just got an email that I haven't had a chance to read yet.
Okay.
We've gone from weekly absence updates to daily absence updates.
Okay.
Today is the first report. It comes in the afternoon. I know I got it before I came in here. I didn't read it, so I don't know if we've had a spike in absences or not. I suspect we will have if we haven't yet, and we'll work through those. I don't want any parents ever feeling they have to send a student who's on the edge health-wise to school, but certainly not in this environment.
What's the policy or plan of action for teachers if they decide they need to stay home?
Same as it always is. I mean, if our teachers are ill, we don't want them infecting each other or our students. So that's a long-standing practice. I think right now there's just a heightened awareness that that's what we should do. Also, I think people have a tendency to tough it out, students and staff. And right now, we don't want them to tough it out. So there's no honor in coming to work sick. There's no honor in coming to school sick. And we want to make sure that message is clear.
What was the tipping point as far as today deciding to do away with non-essential?
Yeah, I wish I knew. I wish there was no epiphany, but I think it's a matter of circumstances. I know Molly and I have had great opportunities to meet with city staff, and yesterday we met directly with some folks at the city, including the chief medical officer of the city. They were very kind and caring with their time, and in my opinion, incredibly competent at what they do. Molly has had other conversations with state health officials as well as officials from Sanford, officials from Avera. And at times like these, I feel, again, how fortunate we are to have the medical resources that we have. But I would say it's using all of that information combined, saying we need to do something. And what we've done, I suppose, is somewhat of a quasi-quarantine where we're closing our doors to the extent that we can.
Can you talk about what the district is doing as far as keeping a clean environment a little bit more?
Yeah, can you talk about that better than I can?
I sure can. Going back in the last few weeks, as we knew that the danger was approaching, we started working with our purchasing department to make sure that we had the supplies that we needed for staff to be able to wipe down frequently used surfaces, the hand sanitizers, working with our operational services department and those custodial staff to make sure that they understand what the cleaning practice should be. So we've been working at this for a few weeks to make sure that staff and folks were prepared to keep our buildings clean.
Our Director of Operational Services is a key person when we have our administrative meetings. And he's a guy that likes to roll up his sleeves and be involved, but I've had him involved in more meetings in the last 48 hours than he would like. But he's a crucial member of our planning team as we address this topic.
Is there any extra measures being taken to make sure that students stay healthy, or like tips for students that are being given?
Do you know of some?
Sure. Yep. We're actually, working with staff to increase the number of opportunities students have to wash their hands. We've provided staff with videos on hand washing information to increase that and to make sure they're doing it properly. We have our school nurses. We're fortunate to have school nurse presence in each building, and so they're working with staff to make sure that they're aware of what some of those practices are, making sure that students are healthy, that if we have 6 children, we're sending them home promptly, and those kind of things. Some of the communication we've also sent out goes back to kind of the basics, eating well, getting plenty of rest, all of those things just help your overall health. And so just encouraging that healthy behavior, and then doing the things that the CDC has guided us in, which are the hand washing, covering your cough, staying home when you're ill, using that alcohol-based hand sanitizer when hand washing isn't available. So we're just making sure that people are well educated and well prepared to be able to handle this and stay healthy if possible.
If someone comes to school and they turn up sick and you suspect maybe it is coronavirus symptoms, can you test, or what do you do?
Yep. So we're fortunate to get some guidance from the Department of Health this week that gives very clear expectations on the symptoms that you would watch for, and in addition to if they had recently traveled from level 3 affected country, or if they'd come from a home or a close contact where they were in contact with a positive case. So it'd be the pairing of the symptoms plus those other identified features. We would keep that student away from other healthy folks. We'd put a mask on them, and then we would contact, obviously, the parent and the Department of Health to let them know of concerns. So the Department of Health has been really clear on what we should do with those situations, and that's certainly what we would do if that came up.
You don't test students here?
No, we don't have the capability. That we're going to refer them on to the health professionals for that.
If parents do decide to keep their children home, what advice do you have, or what should they be doing to let the school district know of their current situation?
Right. So we would encourage them to reach out to their building, talk to their principal about their concerns for their student. As Dr. Maher said, we want parents to make that decision. They know their child's health best, and they should always visit with their healthcare provider too on when it's appropriate for them to be at school, and make that decision with their healthcare provider and the parent.
So it's just a lot of working with the health department really closely then?
Correct. City and state health officials, been in contact with them in the weeks leading up to this week, and on a daily and sometimes more frequent basis than that. And so they have been really helpful in the guidance that they have given us in handling this.
Just curious if the West Central situation had anything to do, you know, such close proximity to us, and we know there's cases in Minnehaha, and
But I think more so than the West Central situation is the fact that it was a Minnehaha County resident on the first day and 2 more Minnehaha County residents on the second day. And the old math teacher in me realizes that that's not necessarily a linear progression, so it makes me a little bit worried. I think in terms of West Central, they did what they needed to do. And I struggle enough trying to run the Sioux Falls School District that I can only assume that Brad Behrens and his staff did what was really essential for the West Sides, or the West Central School District. So not so much what that school system did, but the fact that there was an active case in Minnehaha County was really an important piece in our equation.
You talk a little bit about how important it is for a lot of the students to have this routine of going to school, you know, as far as a way to cope with what's going on.
You know, I think about it, and when I think about that, Perry, I think about our most vulnerable and how important routine is and how many times they don't have routine in their life. I'm really nervous for a school closing, a potential extended school closing, and what will we do for our marginalized students? Many of them count on us for their nutritional needs as well as their educational needs. And so how will we keep some normalcy in their life? And I know I maybe have veered off of your question, but that's really something that's on our minds as we look at all options available to us.
If, for whatever reason, the decision comes where the district decides to close for a day or a few days, what plan of action does the district have to help students who are on free and reduced lunch?
Yeah, well, I don't have anything I'm prepared to say today, but I can tell you that's not something we're waiting to decide. But one very important piece is we would be prepared nearly immediately from a health service or from a food services standpoint to provide some sort of nutrition for students and families. I don't know how that would be administered. I don't know how it would be delivered, but our food services people are working on that as we speak.
Molly, no issue getting cleaning supplies and staying within budget since they had increases for a lot of this stuff.
You're half right.
Yeah. The access is the one piece that there's just a little bit of a delay in what we would normally see for the time that we could get those. So that's been the challenge. The funding piece has not. We have routine vendors that we work with, and our purchasing supervisor could speak more specifically to this, but that we have vendors that we work with and can rely on. So that helps to have that relationship established.
How much of a delay are you seeing?
I think, you know, it usually, and I can't say exactly how often or how soon things ship out, but like I would say maybe a week delay on some of the items that she's told me about.
Have you heard a lot of concern from students or parents about it becoming the Sioux Falls School District?
Yeah, I'm surprised that I haven't heard a lot. I've heard a great deal of concern, a great deal of what if, and I think there is an expectation in the community that we react, and we react wisely, and we react swiftly. I'm not naive enough to think that there will be unanimous support for any of the decisions that we make along this regard, but the community, I think they're expecting us to lead. I talked to all of our principals about that yesterday morning, that I think the community expects us to be some of the leadership that this community sees at this time, and so we'll embrace that and try to lead with as much wisdom and humility as we can muster.
What message do you want to send out to concerned parents or students?
I think the biggest thing that I would send out is our team is fantastic, and I don't mean our administrative team in the Sioux Falls School District. I mean Sanford, I mean Avera, I mean the city health officials, I mean the State Department of Health. That's quite a network. We do not need to feel like the Lone Ranger as we address this issue. We're getting advice, we're getting wisdom, we're getting suggestions from a lot of different places that we trust. And so we need to pull the best of that advice together and put a good plan together. And would suggest to you that we're just beginning that journey. We're not just about through this, we're just beginning the journey.
Pretty hard to say the timeline, but like you said, we have events that are supposed to take place on Saturday. When will decisions be made on that stuff so kids will know yay or nay, on or off?
I think the decisions for anything that have happened right now are out. Those are out. I can't think of a scenario of any external activity that's happening now through Saturday that we will participate in. We haven't made decisions on next week yet, but in the short term, if it's not school or practice at school, we're likely not involved in it.
How often can the community anticipate regular communication?
For right now, daily. I think it's important that we communicate to folks as much as we can. Now, we don't want people to get immune to our correspondence either, but I think right now, we've sent 2 messages out today. I think we've sent out 6 or 7, maybe in the last 10 days. So I think we need to continue with plenty of information getting out.
Just to clarify, that show choir trip, that's out.
Yes.
Yeah. And then maybe I missed something, but does the district have easy access to like test kits and that kind of thing?
We do not.
No, we do not. We would refer families and students on to the health professionals. And I know the health organizations in town are asking folks to call ahead, and so that's just a good reminder for everybody. You know, if you have concerns or if you suspect you maybe need to be tested, to calling ahead to those folks and letting them know that you're coming. So.
And you said so school practices are still going on, are school clubs still going on as well? Because those are within the school.
Like, what would you consider a club? Help me. I'll give you an example, and you tell me if I'm hitting the mark. So baseball is just heating up. Baseball is a club sport. It's not sanctioned by the Activities Association, but we think it's ours.
Or I guess
So-
something not sports related
Chess
that actually a
club.
club. Yeah, like chess
Yep.
club.
If it is our kids,
Okay.
sponsored by our staff,
Okay.
if it's at 4 o'clock, we're okay with that.
Okay.
If it is an external person coming in to take over, then that may be a different circumstance.
Okay.
So again, can you clarify what is being canceled then?
Might be easier if you would ask me a specific event, or it might also be easier to say what's on. If it's an activity that involves the community, so if there's an audience, it's likely canceled. I hesitate to say it is canceled, but I think it is canceled. So I'll say it's likely canceled. Now, for our students who are going somewhere else to participate, whether that's a fine arts activity or an athletic activity, in the short term, that's likely canceled. Does that help? Okay.
Do you have a website or someplace that lists what's on and what's off that people could go to?
We do, and
Will be updated shortly after this.
there you go.
Okay.
We've got like frequently asked questions, some of the correspondence that we've pushed out, trying to consolidate that all into one place so people can get there.
And that's on that's on the school district's website?
Yes, it will be this afternoon.
How much are you, I guess, asking the community to maybe do communication by phone or email or like online registration for various school like milestones that come up, like early childhood registration?
Yeah. You know, I don't know that we've formally asked the community to do that, but we will, thank you. Because one of the things we're doing is so counter to what we want to do. We're really keeping people out of our buildings, even parents. And that's not something we want to do, but we need that social distance. We need our clerical staff and everybody else in the building to be as safe as they can be. So any communication that can take place via email, via phone, we want it to happen in that manner.
Is there any social distancing type scenarios that you're encouraging for students within the classrooms or at recesses or anything like that?
Well, we've talked about different things that could be implemented. Nothing currently, but there are just a few ideas about, staggering times that kids come into the buildings and things like that, and passing times, but nothing that we've implemented so far.
We've talked about a number of things, but we haven't implemented anything district-wide, nothing systemically that we've done.
There was one thing people should keep in mind with all this. What would you tell them, maybe each one of you? One positive thing that they should consider.
I would say remember the simple things that you can do to stay healthy. Wash your hands. Social distancing. Those simple things. If we can take care of those things, we'll take care of a lot of issues. That would be, if I could only say one thing, that would be it.
And I would really echo the same thing. I mean, it does sound very simple and basic, but time and time again, hand washing, staying home when you're sick. In the Midwest, we have that mentality that we're gonna grin and bear it and get through this. If you're ill, to just stay home and keep yourself there until you're feeling well. Reach out to your healthcare provider via phone. I know that's a big deal for the healthcare providers in town right now, making sure that folks are calling in versus inundating the office when you're not feeling well. So some of those basic measures will keep a lot of people safe and healthy.